Welcome to NowClinic. In this tutorial, you'll learn how to have live conversations with patients through NowClinic online care via the convenience of any computer with internet or by telephone at any time you choose. Once you've logged in, you arrive at your personalized home page where you can see your online activity, past conversations, and upcoming appointments. You can also monitor your waiting room, which shows how many patients are waiting to connect with you. To begin connecting with patients, you must first set your availability. Open the My Current Availability drop-down menu and make a selection. If you mark yourself as available by web, you will receive conversation requests directly in your browser. Setting yourself as available by phone allows you to consult with patients with a regular telephone without using a computer. Once you complete a phone conversation, you must wrap up the conversation on the web to receive payment. Once you have made yourself available, patients will be able to request conversations with you immediately. We'll notify you automatically when a patient would like to speak with you. When a patient requests a conversation with you, a yellow drop-down alert appears. Click Review Details to continue to the Review Connection Details page. In the Review Connection Details page, you can review the suggested conversation topics, patient details, and payment information. You can also review the patient's health summary, including existing conditions, medications, and immunizations. Medical malpractice insurance is provided for your online conversations. There are no limits on the number of conversations you can perform, and the policy is independent of any other malpractice insurance policy you may have. After you've reviewed the patient's information, you can decide to begin the conversation, decline the request, or recommend that the patient speak to another physician or specialist. To start the conversation, click Connect. During your conversation, you can communicate with the patient using secure chat, web video, or telephone to discuss the patient's health issues. You can also recommend follow-up actions, provide diagnoses, and write prescriptions. You may also have access to Online Care Insight, which gives you patient-specific guidance, such as evidence-based suggestions, gaps in care, or a medication management. Click the Insight tab to review available information. When you're ready, you may add a diagnosis if you wish in the Encoder tab. To do this, select a diagnosis source, such as CPT codes or ICD-9 codes. Then enter a keyword for the diagnosis or procedure code and click Search. In the results list, select a diagnosis or procedure for the patient and click Add to add that code to the conversation report. To recommend a follow-up action, click the Follow-up tab. Here, you can suggest follow-up conversations, further assessments, patient education packages, or self-care tools. If you recommend a follow-up conversation, you can choose whether the follow-ups will be with you or with another type of physician. To suggest the follow-up, add notes, or set recurrence options, click Add. For prescriptions, click the RX tab. Choose a prescription type from the Source drop-down menu and enter a keyword to search for medications. Browse through the results to find the non-narcotic medication you wish to prescribe. When you select a medication, prescription options are automatically populated from medical guidelines. If you need to prescribe outside of predefined guidelines, select Manual RX Info from the drop-down menu and enter the prescription instructions and desired quantity. Then click Add RX to prescribe the medication. At the end of your conversation, you will have the opportunity to add more diagnoses, procedure codes, prescriptions, or other notes. The Conversation Wrap-Up page allows you to view and edit any information you entered during your conversation. To submit the conversation report, You should include at least one diagnosis or procedure code. Once you click Submit, the patient will be able to view the report and share it with another physician via email or secure message. We hope that you have found this introduction to NowClinic helpful and look forward to seeing you online.